The answer to how often someone should get a skin cancer screening probably varies individual to individual based on risk factors. We most commonly recommend getting an annual check, so once a year for people who have a low risk of skin cancer. That means no personal history or family history of skin cancers. However, people who do have one or more risk factors sometimes are asked to do screenings more frequently, sometimes as often as every 3 months. But that will be a decision made between you and your dermatologist based on the factors that specifically apply to you. We routinely do many skin cancer checks per day at Mount Sinai, and that involves an exam by your dermatologist looking from head to toe at all of your spots and moles and markings, etc. However, there are other tools that we have at our disposal that can help us to better perform these exams and better monitor patients, especially those at higher risk. A good example is this machine behind me called the Vectra WB180, there are only 2 of them in the tri-state area, and it is a very sophisticated mole mapping technology that allows us to generate high fidelity 3D maps of an individual with all of their lesions and spots. And that allows us to really keep a close eye on things, especially for patients that have a higher risk of melanoma and other skin cancers. In addition to that, we have some technologies that involve non-invasive diagnosis and imaging of the skin to allow us to avoid sometimes unnecessary biopsies. And more importantly, to find things that need biopsy better, but without biopsying things that don't need it. So we avoid a lot of scars that way without reducing the level of care and monitoring that we're able to provide.